The GOP's nearly $1 trillion in cuts to Medicaid, contained in the big, beautiful bill, are predictably causing chaos in the healthcare program that millions of low-income Americans rely on. NC Newsline, for example, reported on Wednesday that the North Carolina Department of Health and Human Services, the NCDHHS, has announced plans to cut Medicaid spending in the state by about $319 million starting on October 1st. That means the state will begin reducing rates by 3% to all medical providers. Okay, these are the reimbursement rates, as well as cuts to 8 to 10% for inpatient and residential services and about 10% for behavioral therapy and analysis for patients with autism. So immediately also impacting the disability community, the neurodivergent community. NCDHHS spokesperson Summer Tonizzo had outlined the impact that these cuts will have. She said that the services, including hospice, behavioral health, long-term care, and nursing home services, could see reimbursement rates cut significantly steeper than 3%. These reductions, she said, may cause some providers to stop accepting Medicaid patients altogether, as the lowered rates could make it financially unsustainable to continue offering care. Now, that is an absolute disaster, especially when it comes to nursing homes. As of July 2024, nationally, there's about 1.2 million people living in nursing facilities. Over 60% of them had Medicaid as their primary payer. Medicare doesn't actually cover long-term care. It only actually covers about up to 100 days of skilled nursing facility care following a qualifying hospital stay, and does not cover long-term nursing facility care, custodial nursing facility care, or nursing facility care that does not follow a qualifying hospital stay. So you're on Medicaid and you lose, you're on Medicare and you lose your Medicaid and you need to be in a home, you're out of luck. You're out of luck. Okay? And so, look, Medicaid paid for 44% of the $147 billion that the U.S. government spent on institutional long-term care in 2023. And the Medicaid enrollees who use institutional long-term care are more likely to be 65 years old or older, white, and enrolled in Medicare when compared to those using home care. Now, the reason I bring up these demographics is because a lot of Trump voters and supporters are being affected by this. And again, those are just the national stats. Now, in some of these states, for example, the Tar Heel state, they're not the only ones that are reeling from Trump's Medicaid cuts, as I had given you already the North Carolina numbers, but Colorado is also dealing with the fallout of this stuff. Colorado Public Radio reported that the state's Department of Healthcare Policy and Financing, which manages the state's Medicaid program, held a webinar this week in which it outlined plans to, in the words of the department director, Kim Bimmensteffer, mitigate the loss of coverage and its catastrophic consequences to Coloradans, providers, and the economy. Numbers reviewed by the department estimated that hundreds of thousands of residents in the state could lose their healthcare access thanks to cuts from the GOP's budget package. In addition to the people who will lose coverage due to the work requirements, an estimated 112,000 people who buy health insurance policies from state exchanges could also lose it after the expected expiration of enhanced tax credits passed by Democrats during former President Joe Biden's term. Now, look, what's going on here when it comes to healthcare exchanges, that's why I didn't that's why I wasn't a fan of the ACA. I'm not saying the ACA is bad. I'm not saying that it, didn't help millions of people. It actually did. But what it didn't do was go far enough. What it didn't do was set up a system that could be protected against people like Donald Trump and the current GOP makeup. Okay? It is not protected against these things. And so you have millions of people that are going to see their insurance rates rise dramatically. Dramatically. This is why we should have had, at first, perhaps a public option, okay, during the ACA debate. But me personally, Medicare for all, universal health care, truly universal health care. Don't mess around with the insurance companies. Kick them out. Kick them out. There should be no reason to have a profit motive in healthcare. But, you know, that's because I'm a leftist, and so that's one of the things that leftists believe, is that we should have healthcare. Healthcare is a human right. Corporate Democrats do not share that belief, because obviously we got the Mitt Romney Heritage Foundation healthcare plan, which has all of these problems that are coming to the surface, especially since Republicans have decided we're going to be all against it now, because we don't even think this small amount of healthcare, you know, that is supported by the ACA, we don't think that anybody should have that. Oh, okay. So now, expect, as a result of all this, healthcare costs to skyrocket, as well as elderly folks getting kicked out of nursing home facilities. And this is all the result of Donald Trump's bill that has been touted by Republicans as great. Look, I'm not shocked here, by the way. I'm not shocked. Look, anybody who is surprised that Republicans hate the elderly and the disabled, oh, they especially hate the disabled, should remember that back in 2020, they were openly calling to sacrifice grandmama so they could eat at Applebee's without a mask. That's who they are. So no one should be surprised at all. And no one should be walking around with Pikachu face. Okay? Yeah, it's simple. Simple, right? No, but that said, these cuts are so bad that you do have Republicans in the state level that are pretty concerned. State Line reported that some of the Republicans attending the National Conference of State Legislatures Summit in Boston had expressed some anxiety about the impact of the cuts and how it will affect the people that they represent. Now, I'm going to just come out and say it. I'm almost 100% certain that they're more concerned about their reelection chances than they are anything. But, hey, look, they're still worried. They are concerned. Look, for example, one of the people concerned was Oklahoma State Senator John Hast, who said during the summit that he was concerned about the impact that the cuts will have on rural communities. Like, for example, rural hospitals that are being devastated by these cuts, that depend on Medicaid funding. Among other things, he pointed to provision in the law that would deliver a $209 million cut to Medicaid funds in Oklahoma. Not only that, but he pointed to the fact that complying with the work requirement verifications will actually cost an additional $30 million. So that's one of the other things, right? So, you know, you talk about these work requirements. Oh, we're going to save so much money from work requirements. We're going to get those lazy people to get off their butts and start working. It's the same kind of thing that happens when they talk about drug testing for food stamps, right? Not only does it unfairly target poor people, but also these things tend to cost more to administer than it is to just give people money. I mean, that's what they're doing. They're spending more to ensure that perhaps one person does not get benefits, okay? They're spending more on preventing people from getting aid that they believe shouldn't get than they would ever have saved. I would rather that people who, yes, people who do drugs, I would rather they get food stamps and health care. I know. I would rather those people get health care, okay? than waste all of this money in trying to stop them. And along with stopping them, you stop a whole hell of a lot of other people who need healthcare and food aid. Okay? That it boggles the mind. It boggles the mind. But that's who they are. Okay? That's who these people are. They just don't want people to have food. They just don't want people to have healthcare. Okay? Now, Haste said, quote, all of those things added together come up to a really big number. We don't exactly know what that is. So, talking about the costs here. And look, the costs, they're going to be big. And they're going to be disastrous. And they already are. The amount of damage that is being done and will continue to be done as a result of passing this bill is enormous. And all of it is so that Republicans could just give a massive tax cut to the rich. That's what ultimately benefits from these Republican policies. Rich people. Look, if you're one of those people that is, making what, $30,000 a year, and you think the tax cuts are going to be the best thing ever for you, think again. Think again. Any of the gains, and I've talked about this before, any of the gains from the Republican tax bill is going to be erased by Trump's import taxes. Okay? It's going to be erased by the massive inflation that we've already seen and will continue to see as a result of the import taxes, the ICE raids, funding freezes, and all the other crap that he's doing to the economy. At the end of the day, anyone who is not a millionaire or billionaire loses out because of this bill. And those at the bottom, those who are the most vulnerable, end up losing the most. And that's the way pretty much works with every Republican policy. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.